It's coronavirus and you. With me, Frederick Chitangala, as usual, to be with you for the next 45 minutes. Thank you for joining us once again. This is a program brought to you by Gospel Outreach Fellowship Go Center in Lusaka, Zambia, courtesy of Senior Pastor Reverend Helmut Reuter. It's a program intended to give you some sensitization, education, and updates on what's happening in the realm of COVID-19 in the world as well as in Zambia. As usual, we start with updates. What's happening globally as far as the numbers are concerned? Looking at the live updates, as things stand, we have 26.4 million people that have been confirmed as coronavirus positive cases. And we have, out of those, 873,000 have died. And 18.6 million, almost 18.7 million have recovered. And then South Africa is now number 7. Remember, a few weeks ago, South Africa was number 5 in the world, but is now number 7. Like I said last week, it has been overtaken by Colombia and Peru, okay, who are doing very terribly. I wouldn't say we are doing very good because they've overtaken South Africa. No, it's terribly, all right? But we also don't know what's happening in South Africa, whether they have reduced their testing in Asia or it's just that the numbers are reducing. Back here in Zambia, we are still hovering around the numbers of 12,523 as confirmed yesterday by the Minister of Health. And 292 have died, 11,562 have recovered, leaving us with 669 active cases in Zambia. And you might be dancing and say, hey, look at South Africa. They're on number 5, number 7 in the world, and we are number like 40 or 100. I'm not sure. Let me just check that. It doesn't really matter. We are number 86, but it doesn't matter. You know what matters? How many are you able to test? If we can test 1 million people a day, perhaps we are going to be number 5. Who knows? I'm just saying, okay? What I'm saying is that it's testing that determines where you are positioned as far as confirmed cases are concerned. So today, we are discussing, or we want to listen to some more stories concerning people that have experienced this disease and how it feels like to be there and what is it that we can learn from their experiences. I'm privileged today to have Mr. Peter DC Phiri, who holds a master's degree, a bachelor's degree, and a diploma in physiotherapy. He's a physiotherapist. He has worked for the University Teaching Hospital, UTH, for 15 years before joining the University of Zambia as a lecturer. He has been in the field of physiotherapy for more than 22 years. At UNZA, he teaches physiotherapy to students, including orthopedic conditions, cardiopulmonary conditions, and clinical practice. He is serving his second term as Assistant Dean, Undergraduate in the School of Health Sciences. We have in our midst a physiotherapy, so after this program, I perhaps might ask some, 1 hour session of body touch here and there. It's my honor and privilege this morning to welcome Mr. DC Phiri. Welcome.
Thank you very much, Doctor. I'm also happy to be here, especially to share my story with regard to COVID-19.
Wonderful.
And I would like to also greet the viewers, especially including those who are following us on Facebook. Those who are also just within the country and abroad, and I think you're all welcome, and it's important to always share what we go through as humanity, so that we might know how to do things better.
Wonderful.
Just like in introduction, you've seen the numbers outside there. So how do we do it better ourselves?
That's
Thank
right. We are live on LITOVIA Prism Africa TV, as well as on Facebook. Search for my name or that of Prism Africa. You'll be connected to the live broadcast on Facebook. You can also find the same on YouTube. You will have an opportunity to make that call and ask your question or a contribution to what we will be discussing today, either to me or to Mr. Phiri, my guest. Okay, you can also post that question or contribution on the comment section on our live broadcast on social media. Let me start, Mr. Phiri, by asking first and foremost a question that everyone else is asking in the community. And most people are asking, so how do I get to test? You know, because with HIV, you can just stand up and go and test. You don't have to feel any symptoms. You don't have to be told that, oh, by the way you look, you need to go and test. People just stand up, test, know their status. Why did you take the test? What prompted that?
Firstly, it's very important to underpin the fact that as much as we want to do very well as a country, we have serious limitations in terms of resources. And this is why, if you look at the Ministry of Health, they've given guidelines in terms of who they will test this time around so that they can actually rationalize the kit that they have. I think we have problems in those areas.
Yeah.
So we have tried to say we will not test everybody else as the ministry guide, but we will test those who will present in the hospitals with specific symptoms and so on that with the hospital, the doctors may feel are related to COVID. So testing itself is not is not for everybody, like you've put it in terms of HIV and other tests that people may want to say, let me go for it. In this case now, tests will only be conducted on, for example, people who want to go abroad and so on. The people who are actually sick, who are presenting with symptoms that are related to COVID, those will be tested. So I think there is that rationalization in terms of who to test. At this point in time, I think for me, it's a nice story to share because it did not present the way it's prescribed. And I think
that's what we want to know.
That is very important.
Because we are saying not everyone should taste. And from what we are saying and from what we have heard, and only those who present with symptoms or they suspect to have exposed themselves or come in contact with somebody with symptoms or they are traveling or they have traveled are tested. What is your story?
My story is simple. Raised blood pressure. You know, I want to go and sleep. And then I noticed that I've got a slight headache. And this headache is not going after rehydrating myself, taking a lot of water. You know, the water therapy. It's not going. After 30 minutes, I ask for a Panadol. I take it. I sleep. The following morning, I wake up. I still have a headache. And then I never had the history of raised blood pressure. So in the morning when I woke up, I still had this headache. I say, oh, what's happening? Went for work. And around 10 hours after rehydrating myself again, I expected the headache to go. It never went. So as usual, I had a chat with my head of department, Mr. Schuler, and he said, let's check your blood pressure. And we found it was actually very high. So he says, go home. And
you've never had raised blood pressure before?
No. It's new.
Oh, wow.
For me. So he says, go home, rest. And luckily enough, he gave me a gadget to check my blood pressure at home. Monitor it and come back tomorrow if need be, but you can take your rest. And I took my rest. And I kept checking. And when I kept checking, I found that actually it was still raised. It was in the borderline. You know, 140, 90, 95, you know. So you would say, others will argue that's the high normal and so on, but we also look at age. So as a physiotherapist, I got concerned because, you know, as you may know, high blood pressure can lead to stroke. And we know once stroke happens, it's difficult to rehabilitate these people. So I got concerned and went to the hospital on a Friday. And then I was told, write a BP profile so that we can be able to trace for the next 5 days. And after those 5 days, if you find that it's still up there, then you can come to the hospital. But it kept on being very high. And then Monday, instead of coming to the hospital on Tuesday, the 5th day, I decided to go back on a Monday because I couldn't stand just the raised blood pressure. But the symptom of headache had gone. But just to see that it's raised, I think it bothered me.
So the headache had gone?
Had gone.
But still the blood pressure was high?
Blood pressure was high. And that was also followed by a rise in pulse rate. My pulse rate was reaching 90, and I didn't expect to say 90-something pulse rate. I mean, there's no activity associated with this. So why is this? And I needed it corrected before it's too late. And this is why I went to the hospital prematurely to say, I don't need to wait for these 5 days. I need to see the doctor. And I went back to the hospital. So in the hospital, They looked at me and they checked. They found that the blood pressure, yes, was slightly high. Did some tests. And when I look at this, they did the full blood count, as you may know, Doc. Yeah. Full blood count, liver function tests, cholesterol levels were checked, and so on. Including, of course, the one you were mentioning, they want to see whether this is related to HIV in order to rule out certain things.
Absolutely.
All these tests were done. And unfortunately, they were non-revealing except for the blood pressure. Mm-hmm. So they decided then to say, I think.
So when you say non-revealing, mean?
Non-revealing simply meaning there was nothing that was abnormal associated with the test that they had done.
Okay.
So the tests were within the normal ranges, except that the blood pressure itself was high. And then they decided now to give me some treatment for high blood pressure. And I don't usually mention drugs because people, when they found they have high blood pressure,
start going to buy the same.
Buy. So
because Mr. DC Phiri took the same.
Yeah, so I'll not mention those. But that was the beginning.
Yeah.
And that was somewhere on the 20th July. And then on the 22nd July, I noticed that I lost this taste. The food doesn't taste anything.
There you go.
And then the appetite is gone. And then, unfortunately, I also bled from the nose. And with raised blood pressure, my concern was, where is this going now? Because I'm trying to associate with raised blood pressure.
Yeah.
And I found that, okay, let me get back to the hospital. And I got back to the hospital, and this time they gave me a diagnosis. They didn't do the lab test because it was just a few days. But they suspected that I should have had what we call the common cold, which we commonly call in Comboni chifine.
Yeah.
You know, so they treated me for that, and then they also added an antibiotic. So that I could actually take. So I took those.
You know, the breathing was just okay?
The breathing was fine. I never had any problem at that level for breathing. So cold treatment, continual hypertensive, and the blood pressure had actually gone down to normal. But I had to just maintain because I was feeling these other funny things.
Yeah.
So what happened was the antibiotic they gave me was for 3 days. So after 3 days it finishes, that's when I noticed that I had problems with, one, sleep. I couldn't sleep. And each time I tried to sleep, I started to cough. I cough, I said, okay.
Yes.
And then I had general body pains. Then I said, no, back to the hospital, because this is something else. And you know, with the medical background, I said, no, there is something going on. Yes. So I went back to the hospital. And this is when now at the hospital, they said, this is what you're having a cough, yes. Related to sleeping? I said, yes. And you've lost the taste? Yes. No appetite? I said, yes. But the temperature was normal throughout. So, okay, no pyrexia, no increase in temperature. Blood pressure had normalized, but these now are the symptoms I'm presenting. So the doctor said, let's investigate now. Go for an X-ray, and then also abdominal ultrasound. We want to see in case you may be having other
No mention of COVID at that particular time?
No mention of COVID at that particular time. And then at this, in fact, I should say at this particular time, that's when the doctor, in fact, thought about COVID. Because he said, I think I can suggest a swab. Would you be comfortable with a swab? I said, no problem.
Yes. That's
so that was the first year. So he says, okay, we can do a swab. I said, no problem. So the ultrasound, when we went for the X-ray, I teach like already introduced cardiopulmonary condition. Comment. Viral pneumonia. For me,
red flag.
That was a red flag, and I think the stamp had been hammered.
Oh, yes.
I knew exactly what that should have been. And the ultrasound, of course, they also did ultrasound. The internal organs were found to be okay, but that radiograph gave me a direction that this viral pneumonia is COVID-19. And being escorted by the wife, she says, no, we have no results for...
Oh, you had your wife with you?
Yes. You have no results for the swab, so you can't say this is COVID-19.
Let me take this call.
Please.
Maybe we can continue after that. You're through to coronavirus and you. Thank you so much for calling. May we know who is calling and from where? Okay, please call us back when you're ready. We would like to hear your story or your questions or contributions. And you know that we are here for you. It's a community-based program. Okay, so they've called back. Thank you for calling Coronavirus and UTV program on LITOVIA TV. Where are you calling from? Hello, you're through to the program. May we know your name and where you're calling from? Hello?
Hello, good morning.
Good morning, sir. Thank you for calling the program. We would like to know your name and where you're calling from.
Hello, good afternoon.
Good afternoon. We seem to have a connection problem. Work on it. Let's see what we can do as we proceed with the discussion. So let's continue from that now. Your wife, you're saying, no, we don't have the results yet.
You know, very interesting. She says, no, but they just swabbed you, and we have to wait for the results to confirm. I say, when a radiologist gives this comment, this is very authentic.
Yes.
And oftentimes, if it's CT scan and so on, they are the people, we rely on the reports that these people make.
Mm-hmm.
So I think for me, it's chapter closed. So we went back to the doctor, and then he prescribed again the antibiotic, the same antibiotic he had earlier on prescribed.
Let's take another caller. Thank you for calling our program. May we know where you're calling from and your name? Hello, can you hear us?
Hello?
See if we be lucky. In the meantime, I don't know, maybe my technicians can follow up and see whether the problem is within the studio or out there. Yes, sir. Please, you can continue.
So we went back, and the doctor prescribed again the antibiotic that I had taken earlier on to continue, instead of 3 days now, to 6 days.
Mm-hmm.
And then that's when he mentioned that you need to do self-quarantine.
Mm-hmm.
And then, you know, self-quarantine, I say, how do I do this, you know? So I went home, discussed with my wife, and we said, okay, fine, it's easier, we'll keep you in the bedroom, it's self-contained, and you'll be there, and we can give you food and everything else. But she also remained in there. She just looked for another mattress to put us on by the
Perhaps
side.
because she had already been exposed to you, right?
Probably.
Yes.
And also just the traditional aspect that maybe coming up, you know, if assuming that I have problems in the night and I pass on and she's away, what will people say? You know, so there are also these attachments which people are scared of. Instead of leaving somebody, because I was not in distress such that I could not be left alone.
Mm-hmm.
But sometimes society has it that a person somehow is sick and has to be looked after.
Yes.
So those also become problems. So I was with her in that bedroom, and you know, we separate where do we sleep.
Yeah, yeah.
We are using the same bathtub.
Yes.
We are using the same door handles.
Yes.
The soap is the same. So really, we are caged, the two of us. So that went on, and that was on a Friday when we were swabbed at UTH.
Mm-hmm.
And then on Monday, my dean took interest in it, Dr. Monsaka.
Let's try another caller. Thank you for calling the program. May we know where you're calling from and your name, please. Hello, you're through to the program. Getting your calls, if you don't manage to get any, perhaps I just need to give Mr. Phiri more time. Please continue.
So. Yeah. So, you know, we isolate, and then that was on a Friday.
Mm.
Saturday, Sunday, Monday, my dean, I think, got consent because the role of assistant dean, I help with regard to registration of students, releasing their results if they cleared, and so on. So it's a critical role. So he got consent. He made a follow-up with UTH to look at where the samples had been taken. And unfortunately, they could not trace these samples, and he decided now to come and re-swab me. So he came home, because I'm isolated. I can't now travel freely.
My dean,
So
got consent.
I had to...
Please continue.
Yeah, I had to now stay home. I'm in quarantine, and the dean now had to come home to swab me. So he
Again,
came,
right?
This is the second time I'm being swabbed, the fourth day. So he came and swabbed me and my wife. And 2 days later, results came, and I was positive to COVID-19.
Yeah, so let's go back. The first swab, was it out already? The result?
The first swab, this is day 46 we are talking today, it's not out.
It's not out?
No.
Okay, I'll get back to that, especially in discussing the drawbacks of that. Let's continue from now, the second. By the way, please, we have now changed the number that you can call 0977-616320. 0977-616320. And that's my number. If I notice that your name is in my phone, I'm perhaps not going to pick your call because I know it's related to the program. 0977-616320. 0977-616320. Call that number. We want to hear from you.
Yeah.
Please.
So like I was saying, we were swabbed on the 28th. That was my wife and me. And on the 30th, results were out, 30th July. I was positive of COVID. My wife was negative. And as you may know, we were just relying on these, sometimes you talk of these traditional things that people talk about, you get these leaves and so on, steam yourselves and so on.
Yes.
It could give some relief here, there, and so on, but basically no specific treatment was conducted apart from the first 2 antibiotics I took earlier on. So I just went into isolation. And after that, I got concerned because I said, we have children in this home, so how safe are they? We need to actually have a clearer picture about them. So I had a chat with the Dean, School of Health Sciences, that I needed my family to be swabbed. So an arrangement was made, and they were swabbed together with faculty. So, and at this time, on 5th August, when family went for swabbing, my wife took advantage, said, let me also have a second swab.
Yeah.
Very interesting. So on her second swab, she tests positive. The children are negative.
Meanwhile, in the last few days, she was mingling with the children, right?
Yes. She mingled with the children, but there was a little restriction that we put. But she could still mingle with the children. And now she goes to take the children, because when we tested, the children were not around. So she tests with the children. She comes out positive. The children are all negative. And I could see the trauma, the change of status.
But she had no symptoms.
No, she didn't have symptoms then.
Yeah.
So, and the trauma triggers things. You start thinking about some of these things, and you have like symptoms and so on. And in the end, she joins me. Now we are the two of us, husband and wife, isolated. And very interesting that specific doors were for us. Bedroom, the door to the sitting room, and outside ours. The kids have their own doors, and they would save us. So we were there, obeyed the rules of quarantine, and that was it. For now, we are both positive, and we were in there. And on the 30th, I think on the 7th, that's when the results came for the swabbing for the family. But on the 18th August, we had reached the correct number of days. For me, I'd even exceeded the 14 days people talk about. So I said, okay, fine. Let's go now for swabbing. So, and personally, I was very sure that I'm going to be cleared. We went there, and we went to the university the university clinic at main campus. That's me now and my wife. We were swabbed. Results came out positive again.
For both of you?
For both of us.
More than 14 days later?
More than 14 days later. For me, it should have been even 22, somewhere there, days later. Positive. Then, being a little bit scientific, I started asking more. And then they told me, it was a weak positive. It could be the disease is weaning off, or sometimes you might get a weak positive at the start of the disease and so on. But I said positive is positive.
Yes.
Because that meant now quarantine continues.
It's either you have no electricity or you have.
Oh, that's it. So that meant quarantine continues. And it did continue.
Yeah.
So both of us, again, positive, and we continue with the quarantine. And of course, the children are there. They can only save us with limitations and so on. And then 2nd September, the dean calls me and says, you can again come for swabbing. I've organized something at main campus again, Yonza Clinic. And we went there. This is the day when we bought our freedom. That, no, I think now you are both negative. So we were very happy, and that news came in the night, and you can imagine my wife just jumped out of her mattress.
Hallelujah.
Went to the kids to announce the good news and say, hey, we are now negative, so we can mingle with you guys, that kind of thing.
I can imagine the smiles on her face,
she
right?
was all over calling the friends and so on. Hey, we are now negative, we can mingle. I said, no, but only within the home.
Yes.
Outside the gate, each one masks up, because there is no guarantee that you will not get it anymore. Yeah. Everybody can actually get it. So we are not immune. Science has not yet said if you had it, you never get it. And we've had stories in China where people have had the recurrence in them. So it's to say within the yard, we can have a little bit of a breather, because it was very cumbersome. In the home, every child had a mask. Only when they are eating would they remove the masks. Us, again, outside, we had masks. Husband and wife, we are seated.
And did you say you have three children?
I have 2 biological ones, but there are 4 that I keep.
How old are the youngest?
Amongst those that are home, the youngest is 17.
Ah, okay.
So they are a little bit more independent. They cannot say daddy, mommy, and make us... No, yeah. So that was the issue.
But what was the children's reaction to your isolation?
Exactly. I think the children were mature. They showed maturity. We explained. We called them. Firstly, when I tested positive, we called them and explained to them what this meant for them, and how we thought they should live themselves, and how we can actually guide them in terms of how we refer to each other, how we interact. That you can no longer interact with Papa. It's over.
Yes.
Until such a time that he tests in this direction. So that's what we did. So children, in fact, they didn't have that trauma that you would actually expect, except that sometimes it's very difficult to measure psychological issues, except if you are going to do stress tests and so on. But otherwise, they were very supportive in terms of giving us what we needed as a family. We only gave directives. Meals, we just directed this and that, and they would do everything for us. This teaming we are talking about, they're the ones who would wake up 04, 05. They make sure by 7 hours we are both steamed.
I have somebody who is calling, is a person you perhaps want to hear.
Okay.
Thank you so much for calling our program. Dr. Musaka, please may you proceed with your contribution.
Thank you very much, Dr. Stanara and Mr. Phiri. This is very wonderful. I'm really glad that Mr. Phiri has come out and just to discuss this disease and what he's gone through. I think what is important is this will break the stigma.
That's right.
That is associated. I'm glad that I went out of the way to go and actually have him swabbed and play the role. So I'm very proud and thank you very much.
Yeah.
Okay, bye.
We are blessed to have you, Doc. May you continue good work and may you stay protected all the way.
Thank you.
Thank you so much for your call.
And what's also very interesting is, just like the dean is saying, assuming that he didn't make a follow-up 4 days later to retest, and they have not gotten the results 46 days after the swabbing.
You could have made wrong assumptions.
because they say 14 days, and I was told that after 14 days, if they don't call you, it means you're fine. And they've never called up to now. They've never made the follow-up up to now. Even within the sickness itself, when my wife didn't feel well, she had utulaso in Bemba.
Yeah.
The doctor who saw us that actually we are both COVID positive. Oh my God. You could see the discomfort.
From the medical personnel?
Yes. So medical personnel need also we need to protect them as community. And we also need to help them by doing the right thing. And I had to declare so that she knows exactly who she's dealing with. And I said, this is the status we're in. But then, the way the reaction you can read, somebody is not themselves. You're supposed to be this side, you're supposed to be this side. I said, no, we are supposed to be here. And we made consultations and came back and said, what is it? I said, no, this is the problem. And it was very good. She was also understanding. And I really feel for medical personnel, because people are coming with this disease. Some of them don't know.
Yes.
And when they come to see medical personnel, they have full-blown cases, and they are at a level where they have high transmission. And when we are saying, let everybody mask up, even in the hospital, I think we must have serious rules. If somebody is not masked up, they don't even have to get into the gate of the hospital. So that we can protect each other.
Absolutely.
Protect your health personnel. There are very few.
Absolutely.
Protect them. Declare who are you that they are dealing with, so that they can also take precautions, extra precautions if needed. So I thought that was very, very important, and we need to look after each other, and especially that even these tests, first test I was assured, get back to you. The second test, they got back to me, and I knew exactly, so this is it. Let's obey 14 days. After that number, my wife tests positive. Oh, so she's joined me. Okay, let's look after each other. We go back, test again, back quarantine, obey. But I think all in all, I would say it's really been very nice. And for me, in particular, as Peter, I thank God for his mercy. It's not that maybe we are so special than anybody else out there.
Amen.
And I can assure you, nobody is smarter. Let's listen to the guidelines of Ministry of Health.
Absolutely.
Let us follow them to the latter, so that even when you're infected, you tried.
Yes.
Unlike these issues where we can actually do as we want, because I know you, doc, and so on, and then I want to pretend that you're okay when I don't know where you come from and so on. It's not correct. So for me, I thank God mostly in that the declaration, and this is very important, the declaration that I was COVID-free or negative, so to say, then came exactly 40 days after the testing positive. Exactly.
Not after the test that didn't come out, but after
not
testing.
the UTH one.
Okay.
The UTH one is 46 days. The UTH one, I don't have results even to date.
Let's talk public health. I know you are in physiotherapy, but let's talk public health here. When a result is taking that long to come out, what do you think are the implications on our efforts to fight this disease?
It's a lost issue. I think contact tracing is fallen in the gaps, because these results go to UTH or through Ministry of Health. They announce how many people have tested positive, how many people are negative. And they're supposed to make follow-ups to see so that they can limit the spread. Unfortunately, this length in declaring somebody either negative or positive is not working to the good of the community.
Yeah.
One, I would have continued, assuming they didn't come, I would have continued associating with my friends. And even if you say associating with my friends, I reduced. But after 14 days, because I was told that after 14 days, you are not cold, it means you're okay. So now imagine, I didn't go for the second test, and after 14 days,
start roaming around free.
Come on, I'm a free radical, and then I would have been spreading it. So I think public health must firstly take interest. Documents, and I'll be very serious on this, In Zambia, we're very good at documentation. We can write very well. The problem is in implementation.
Yeah.
And I think this is where public health, if they need more personnel, they need to recruit more. They must recruit more people so that they can be realistic in the document that they've just released. Where they are saying contact tracing. There is no contact tracing. I even asked my colleagues from who I met, who are positives, and we both went for a second test. If they were called, none of them was called. None of them was followed.
And you gave the contacts?
We gave contacts. In fact, on that thing, everything is there. On the form, as you are signing, all the details are there. None of them was called. I was not called. My wife was not called. Not once. If you're talking of the two of us, it's about 4 times. We are not called. So who is it that they call? Who do they follow? I think, for me, my appeal is that public health needs to do more. We don't need that rhetoric where I come to TV and say this is the issue. No. Get to the ground. When a person tests positive, let's follow them. Imagine I'm not as educated as others are. I'm in the compound. I'm not privileged. How many children are sitting there? How I wish those donations we had earlier on for Ministry of Health were now.
Yeah.
Where communities offered a hotel. Because the moment I tested positive myself, I was supposed to be isolated from my family. I didn't need to be part of my family. I should have gone elsewhere. If it meant meeting low cost, I would have paid to be isolated away from my home and protect my family. But then I go back home where I have my wife, I have my children. And regardless of the level of implementation of the interaction aspect, you can't be perfect.
Yeah.
So at the end of the day, I think we need to scale up these cases in terms of follow-ups. When we get that data from people, it's not for prestige. When you get the phone, it's not for prestige. People must be called, we have your results today, they are such. And even just to sometimes impromptu. Take a sample for the people you are saying you have quarantined. Go and find out and say, impromptu, and say, oh, are they here? You may find they've gone shopping.
Yeah. And then come back in the
We had those cases in Botswana where MPs, after being told that they were positive, they went to shop so that they can hibernate nicely.
Let's talk about, I mean, you're being tested 4 times, right?
Yeah.
Some people are saying, I've been tested once, and my results have never come. On the 26th of July, assumed negative. But you never know. Look at yourself. You know, if you made just that a wrong assumption, how many you could have infected? How comfortable is it? Let me take a call from another person you probably know.
Okay.
Yeah. Thank you, Mr. Chiruba, for calling Coronavirus and UTV program. Proceed with your contribution or question.
Thank you so much, Dr. Stangala, and thank you, Mr. Phiri. I think Mr. Phiri brings out a point that has to do with the health system resilience, where he's talking about the results that have taken, I think, I don't know if it's longer than 40 days.
Yes.
Some of the results up to now have not been even released. I think it's very key also, I think this brings to light that it's very key for us to also understand that health system in low resources settings such as African countries have actually often been grappled with the challenges that has been posed by COVID-19. And we have a system that is overwhelmed, such that due to increased demand for services due to COVID-19, also health worker deaths, resource diversion, and the closure of health facilities which compromise the utilization of universal health coverage. So this brings to light issues to do with the universal health coverage. Now, if you see what he has highlighted and you compare to the routine services, how an ordinary person that could have been booked for a surgery, an ordinary person could have been booked maybe for a chemotherapy or any service
that could be offered from the same facilities that are attending to the COVID-19 patients, you realize that we have actually gotten to a stage where actually our health system is being tested in terms of delivery and utilization of routine health services.
Absolutely.
And I think this is very key. We need to be learning lessons from experiences like the one that Mr. Phiri brings forth, so that we can see how we can adapt or modify our health system to meet the demand. Because not only do we need to deal with COVID-19, but also we need to be dealing with the routine services that have been disturbed or disrupted due to the pandemic. I think that's my contribution with respect to the delay.
Thank you so much. A very, very interesting contribution and very practical indeed. And I hope some policymakers out there are listening. Have a good day, Mr. Chiruba. God bless you.
Thank you so much.
So, very clear contributions.
Indeed, indeed.
We were talking about how comfortable or uncomfortable the testing is.
Exactly. This test, I've heard people saying it's painful. It's the discomfort that you get. You know, somebody's getting through your knee. For me, it's just a discomfort.
Yeah.
It's not painful.
And doesn't take long.
No, it doesn't. In fact, I have done it 4 times. My wife has done it 4 times.
And the children did it.
The children did it.
Yes.
So, I mean, it's not a painful test. It's just a very simple test where they just put this little thing through your nose and just maybe twist it a little to get the correct sample.
Yeah.
Otherwise, you can go as many times as possible.
Yeah.
Otherwise, it's just a momentary discomfort that you get. It should be able to clear within 10 minutes.
Absolutely.
Exactly.
Chances are that, just as it were with HIV, you remember in the early 90s, especially when we began testing, we had Gene 2, we had Abordetamine then. They were very expensive, okay? Chances are that in the next few months, testing for COVID will become cheaper and cheaper and might be available in several other places. So I think your experience and what we have just said should be able to encourage someone that when they have a chance to taste, especially as we are going in the next few months or even the next year, because we know COVID is going to be with us for some time, people must be free, must be looking forward to testing so that they can know how to protect other people that are near them. Now, there's a question that I always ask either experts or people like you yourself that have experienced this disease, and you have heard this. Even now, there are people who are saying there is no COVID. And I'll tell you why they are saying this. Okay, because I've seen perhaps 1 or 2 leaders having meetings, political meetings, with crowds without any respect to public health guidelines. Or perhaps they haven't seen anyone who has had COVID-19 before. Even there are people who are watching you right now, oh no, it doesn't look like he had. Yeah. These are staged. People are saying, Honorable Chiruba has staged that disease.
Yes,
What can you say to people like, look at you, you had blood pressure raised that you have never had before. You had a strange headache. You had nose bleeding. You had viral pneumonia.
Yes.
What can you say to such people?
Unfortunately, in Africa, seeing is believing. So if none of their relatives has been affected, they will tell you it doesn't exist. I think colleagues, Zambians, youths, the elderly, I'm speaking from the bottom of my heart. Yeah. It is real. And it will be very unfortunate when it gets you, for you to know that it's real. COVID exists. And I'll tell you that this is a disease where every one of us, and rightly like you put it in the introduction, I teach cardiopulmonary conditions. In other words, cardiorespiratory conditions, diseases to do with the lungs and the heart. That's what I teach, but I got it. So it's real, it's there. And for me, when I looked at the radiograph, it clearly showed my lungs on the bases. The bottom of the heart, where you have a lot of gas exchange when it comes to you breathing. That's why gaseous exchange takes place so much. Those areas were opaque, they were sealed. consolidated, meaning they were not taking part anymore in helping me breathe. So it is real, but luckily enough, viral in terms of resorption, if you have your good immunity and everything else, you may be able to come out easily and your lungs back to normal the way they were.
Yeah.
So I'm just trying to say, Doc, it's not something that we should play around with. It's real. It's there. And these politicians you're talking about, whom you may see here and there, they've gone through it. And it's also dependent on how you look after yourself. Remember, in Italy, for example, I was just talking to a priest in Italy. In Italy, to enforce the lockdowns, they were using helicopters. There were helicopters in the air. And there were police everywhere on the ground. Is that what we want, a police state of some sort? No. So can each citizen take responsibility? Let's look after each other. Let's follow the guidelines. These meters are not difficult. The way you are there, I'm here. And the way we are here, if I open my mouth, I drop my mask, I'm talking. And the droplets will be able to reach Doc here. But you can have this freedom because I'm masked. So as I talk, it may not affect you.
Thank you so much for calling. May we know who is calling and from where?
Good afternoon.
Good afternoon.
Yes, my name is Sylvia.
Kindly switch on or reduce the volume on your TV set if it's on, or you can walk away from there.
Yes, I'm on from the TV.
Okay.
My name is Sylvia, and
You're calling from?
I'm calling from within Lusaka, from Kabata.
All right, Sylvia. Please proceed with your contribution or question.
Yes, I'd like to find out from the Mr. Phiri.
Yes, please.
Yes, how he would advise the people out there, and how he will be able to help us. What kind of symptoms to be on the lookout? Because from what he has explained, it seems that it takes maybe like each and every other person, they may come out with different symptoms. Because when we go to what is being presented on TV, like what to watch out for and what Mr. Phiri went through, it's a bit more like different. So how would we be able to advise like the general public how to be able to be watchful or to look out for maybe other symptoms that may be related to COVID? Because it seems like what is being publicized on TV as what to watch for and what he went through, there is a little bit of some diversion. So maybe as he went on through when he was in quarantine, what other symptoms that he may have experienced that are different from whatever we have been told to be watchful or look out for?
Thank you very much for that question. I would simply say, when you are not feeling well, get to the nearest clinic. And this is because we have seen what we'll say the mutations, the changes in terms of the presentation of this disease. Others, you'll find that their sugar levels are just getting out of control, apart from high blood pressure. And when you go there, you find that within a short time, you are also able to develop respiratory disease. There is no prescribed pattern, and this is the challenge that we are facing in the community. If you followed my submission correctly, for example, on treatment, I did not mention the specific antibiotics given. Sleep is problems to do with sleep, I didn't mention. The reason is that if I, for example, just say, I took this antibiotic, people are saying, oh, if you feel like this, then go and buy that antibiotic. This is what we avoid in the health sector. We're saying, when you're not, we can actually advise is, let's get to the nearest health center. Let's get checked. And after checking, then we'll get the correct advice. Other lines. But it's to take to say, for example, if I'm feeling this, so abnormal levels, unprecedented, but the headache might not even be slight. Some may not even have a headache, and you find them collapsing. So my advice is, on those symptoms you are looking for, don't look for symptoms. But when you're just not feeling well, take concern. It's your body. And God has entrusted you to look after that particular body because it harbors the Spirit of God. Take it to the right people who can actually advise you on how to look after it. Otherwise, symptoms will be very, very different. Others will present with headaches. raised and controlled blood pressure, sugar levels going up high. Others, even diarrhea now, diseases are also coming. So it's mutating, it's changing.
Yeah.
So I would rather say it's not just the respiratory presentations that we have seen, because at the end of the day, I've also seen this, Doc. Every month, for example, they are checking temperature as you are going in. Mm-hmm. And temperature, when it's raised, it may not necessarily say COVID.
Yeah.
They are saying it was going in slowly. And had I, for example, delayed, maybe I could have had more challenges. So my advice, my sister, is that when you are not feeling well, go to the nearest clinic so that they can actually look at those symptoms and interpret them for you and help you understand. Most of the medical personnel will be able to add A plus B and help you actually get the necessary help. Thank you.
Wonderful. Thank you, Sylvia, for that call. And thank you, Invid, for watching this program. One or two comments from social media and texts. I've got Mr. Nsaluka, who is our perpetual caller. I'm surprised. I think he's one of those that failed to go through. It's nice to see what Mr. Phiri has become, because
yes,
you can bear me witness that so many people have refused to appear on TV and have tried to convince a few, and all they say is stigma. And this is why Dr. Musaka said it's important that we start speaking about this openly, especially those who have gone through this, so that people can start now registering that this thing is real.
It is real.
Sweetheart Martha Kamanga, thank you for watching. She says, Sweetheart Martha Kamanga is watching.
Oh, okay.
I really don't know her.
That's my wife.
Really? I was almost asking you, Sweetheart, what's your number?
You know. Yeah.
Thank you so much, Mrs. Phiri. Please continue with...
That's another survivor.
Yes. Continue with what your husband is doing. We want so many people to know that this thing is real. So many carelessness. Go in the malls, go in town, go in the market. People in the minibuses, people just don't care, you know. So what you are doing with your husband, please continue that. Now, I know the answer to this next question from Elijah. Good afternoon. Just a question. What medication do they use to get a recovery? He's not going to tell you. No. My friend, no self-treatment. Go, have yourself checked by the doctors. They tell you what medication
Thank you, Presenter. We don't say that. No, we don't.
Mr. Kamanga, unless you... Mr. Kamanga, can you now see what I'm doing?
You know, you're mentioning my wife now. You know, you're transferring her name.
Mr. Phiri. Okay, Mr. Phiri. Your last few words, quickly, as I've been signaled that we have run out of time.
My last few words really is to thank the faculty, Health Sciences. I think they've been with me through this, more especially the dean, who took personal interest in making these follow-ups and also allowing my children to be screened as part of faculty. I thank you so much, and continue to look after every member like that. And I think if the leadership in the community, everybody takes that step, it will be a different society. I want also to thank my colleagues, friends. Some of them I may not mention. Yeah. They gave me moral support. Some of them even money for talk time. You know, Peter, you're here, go and buy drinks. Yes. You guys, I thank you so much and I salute you. Also, I cannot fail to mention Dr. Chitanga with Dr. Monsaka, both from the lab, who really made sure that they traced and said, no, hey, Assistant Dean, we want this done. I thank them so much, my head of department, and also Charles Ndakala. Dr. Ndakala is, I think, one of the big guys in the Ministry of Education. This is also my colleague patient, who I have been exercising with. I'm a physiotherapist, so I told him, and I even gave him positions in case he has challenges in terms of breathing. Yeah. So I've been actually moving around with him and exercising with him, and now he's also back in office. So thank you, Doc, for the company that we had, and it's great. Thank you. And Zambians, COVID is real. Stay safe, protect yourselves, and follow the guidelines. It's very simple. Wash your hands, use the sanitizer, keep a distance. The mask is a must. Traveling in the minibuses and everything else, and especially the conductors. Can we make sure that we protect the people that are with us? Thank you so much.
Mr. Phiri, thank you so much.
You're welcome.
This has been Frederick Chitangala on coronavirus, and you featuring Mr. Peter DC Phiri, a COVID-19 survivor, and what an experience, and I'm sure you've benefited a lot from his stories. Next time we'll be back with another enriching and educative topic. topic. In the meantime, please remember your health is your choice. Bye-bye.
Thank you.
Turi matako ya mpoto tuwane fyakaba tuwane omulilo twali belesha obulungi mwelesa nafikosanga kukonga befwe balila mu malembe nafikosanga kukonga befwe balila mu makwebo lesa wilala abapena wilala wishibula abapena mwidukudatila lesa abapena wilala